listen.
Call Curtis investigates children restrained at the dentist office. A mother wants the state to investigate a Rancho Cordova dentist after she says he left her 7-year-old bruised, cut, and traumatized.
Curtis Main looks into these controversial restraints, which are perfectly legal. Yes, some compare these restraints to straitjackets. This 7-year-old is a fidgety patient, so much so his regular dentist referred him to another one. But this mom thinks that dentist, who specializes in kids, went too far.
It makes me want to cry thinking about it.
Julie Pignon says no child should look like this leaving the dentist.
The back of his ear was like raw. Like the skin was peeled back a little bit.
My nails
Marks
look
on
cute.
7-year-old Ryan's face, broken blood vessels on his chest. He admits he fought back while the dentist pulled one tooth and filled another.
Say, stop it. Stop moving, because they're going to make more blood come out.
Why were you putting up a fight?
Because I was trying to tell him to stop and he won't listen.
He says Dr. Wayne Grossman at Gold River Pediatric Dentistry then restrained him, strapping him down in one of these, called a papoose board.
A straitjacket.
You think it was like a straitjacket?
A straitjacket, but you're laying down.
It is a straitjacket with a board in it.
The restraints are legal, but dentist Mark Berhana compares them to a torture device.
This is a lot like waterboarding. This is called the papoose board.
We asked her to show us how one works on this child with her parents' permission. After strapping her in, she can't move.
It feels tight.
You can't raise your hand, you can't move, right?
Yeah.
She's immobilized.
Which he says can traumatize a patient for life.
There are psychological ramifications after having used that. It's kind of a dental PTSD.
He prefers sedation. The pediatric dentist, Dr. Stephen Perlman, defends papoose boards, saying he often treats the kids no other dentist will see, those with behavioral problems and disabilities.
Medical immobilization is the safest form of treatment.
He says sedating kids is unpredictable and can be dangerous, and says there is no proof papoose boards have psychological ramifications. In fact, in his 40 years of dentistry, he says they often have a calming effect on kids.
My job as a pediatric dentist is to raise the generation of children that aren't afraid of the dentist. The skill is working with the child so he doesn't have any fears and is a good patient.
It's just so heartbreaking.
4-year-old Nevaeh Hull suffered brain damage while getting her teeth capped. The Texas girl's family says the dentist strapped her down to a papoose board and gave her sedatives.
This child was chemically and physically suffocated.
Dr. Perlman says it's important the dentist discusses the options with a parent before the procedure.
We have them sign a basic consent form.
Julie admits signing this waiver, stating Dr. Grossman may recommend a papoose board in order to prevent movements that would jeopardize your child's safety during treatment.
I didn't sign up for my son to be abused. I didn't sign up for him to have marks on the side of his head.
We reached out to Dr. Grossman, who emailed us a statement saying this case is about a child with an emergency situation, not treatable by others due to his behavior, which could soon suffer a major body infection. According to professional guidelines, he was not a candidate for in-office sedation or general anesthesia. He was an appropriate candidate for treatment with an immobilization stabilization device. We used this approach with a mother's consent. Julie admits she knew it was a possibility, but says she asked to be told before the restraint was used.
He could have came out and let me know what was going on, maybe try to have me calm him down.
Ryan's marks have since healed,
Love you.
I love you, Mommy.
but she's afraid of the lasting scars you can't see.
I just do not want to remember that.
The American Academy of Pediatric Dentistry says a parent has the right to terminate use of restraint at any time. But Mom Julie says she was not allowed in the room. She says in the past, doctors put her son in a papoose when he got stitches, but she was allowed to be there. The Dental Board of California says it has no policy on the use of restraints. Julie has filed a complaint with the agency. Now, we've posted Dr. Grossman's full response on our website, cbs13.com/callcurtis.
Now, do we know how many dentists use these?
You know, there is a study in 2010, and that study says as many as 72% of pediatric dentists do have restraints and do use them on some patients. But it also showed that there is a declining number of dentists using these as well. And does his dentist have any blemishes on his record? No,
we searched. He's been a dentist in California since 1975. We could find no disciplinary action, no blemishes on his record at all. But, you know, this mom says if she had to do it all over again, she would demand to be in that room. And if the dentist says no, then she would say, I'm going to take my child somewhere else. Yeah. And if you have a consumer problem you can't resolve, we're here for you. Just go to our website, cbs13.com/call-Curtis, and fill out our form.
Some of your favorite California fruits and nuts are grown with wastewater from oil fields, but is it